Hello, and thank you for tuning in to our Facebook Live about COVID-19. I'm Elizabeth Van Camp, and I'm a member of the University of Iowa Hospitals and Clinics social media team. Dr. Teresa Brennan, Chief Medical Officer at UI Hospitals and Clinics, and I will be discussing what we know about COVID-19 now, how we're treating patients at our hospital, and what we recommend people to be doing out in the community to stay safe. Thank you for joining us today, Dr. Brennan.
Oh, happy to. Thanks, Elizabeth.
Yeah. So this is a live broadcast, so please comment with your questions and we'll get to as many as possible. Before we begin, this video is for informational purposes only. If you feel sick or are concerned about your health, we encourage you to contact your primary care provider or schedule a video visit to speak to one of our providers. We'll include the link to our video visits in the comments below. So Dr. Brennan, it was just over a month ago that you and I sat down together in the same room to discuss this new virus that everyone was feeling a little nervous about. And that feels like a lifetime ago, especially considering all we've learned about COVID-19. So let's talk about what we've learned since that first time we've talked. COVID-19 is a virus that can spread faster than influenza. What else do we know about the virus and how it can spread?
So we know that the virus spreads by droplets, meaning that when you cough or sneeze, or even sometimes when people speak, that droplets can come out of your mouth. And if you have COVID-19, those droplets can contain the virus. The virus then in those droplets can land on a surface. And when other people touch that surface, if the virus is still alive or viable, meaning able to cause infection at that time, they can pick it up with their hands and touch their face and infect themselves. We also know that there are certain procedures that we do as healthcare workers that make the virus more prominent in the air. We call those aerosolizing. So a lot of it has to do with breathing procedures when we're putting tubes in the throat to breathe for people, or when we're giving nebulizer treatments. So based on that, we have created guidelines for our staff, similar to hospitals across the country, of what sort of protective equipment they need to wear. We also know that the virus does have a higher likelihood of causing people to have very severe complications of the virus and to even die, and that likelihood increases with age. When we first heard about it in China and Italy and other countries, it really seemed like young people were really being spared, that they weren't really having any trouble with the virus. We did know that they were able to catch the virus. They were getting a disease, but it seemed milder. What we're seeing now is that that's still probably mostly true, but some young people actually do get pretty sick. And nationally, we've seen a couple children that have died.
So how does COVID-19 affect our bodies? And do we know why some people are asymptomatic while others have severe symptoms?
Yeah, we don't know what causes some people to really be fortunate enough to have lesser symptoms or even no symptoms. As I said, we do know age probably plays a role in that. And then that's probably related to the immune system. But the virus itself, generally, I can tell you a little bit about the course of the virus and then what it does to the body. So the first 5 to 7 days, what we're seeing is patients have symptoms that are very similar to influenza, the flu. They'll have body aches, they'll have a cough, maybe a dry cough usually, some fever, headaches, just generally feeling not great. After the first week, most patients get better, and about 80% of patients don't require hospitalization. That's a number that really is consistent nationally and internationally. After that first week, there are some patients that get worse, and what happens with those patients is they start to have more breathing trouble. The virus actually causes damage to the lungs, and so that breathing trouble can be related to that. The virus actually also can cause damage to the heart as well. And people can then develop what we call heart failure, which means that the heart can't pump well enough to get all the blood to go forward that we need to really supply energy and nutrients to our body. And so they get difficulties with fluid in their lungs, and can even have trouble with bad heart rhythms. What we've found out a little bit more recently is they tend to be more susceptible to developing blood clots. So many people may know someone who has had a blood clot in their leg that then went to their lungs. That's the kind of blood clotting that we're talking about, blood clots that happen in the veins of the body. And those can be very dangerous. And so blood thinners are really important. So the virus attacks the lungs, can attack the heart. Many people then will develop kidney failure and can have other organs involved too if they become very, very sick.
Okay. So what are the best ways that people can continue to keep themselves safe and try to stay healthy right now?
Yeah, so this is the easy one because we've been talking about this since the beginning.
Yeah.
It seems easy, but it's not actually so easy. It's really about developing good habits. It's about washing your hands, making sure that you wash them appropriately. Remember that 20 seconds, sing happy birthday, the ABCs, whatever it is that helps you to work out to 20, to know that you're going to lather for that time and then you're going to rinse, or use hand hygiene gel. And my recommendation would be, washing is great, and it's probably the first line, but if you're not in a place where you have soap and water, keep hand hygiene gel with you. Keep it in your car, have it, in various spots in your house, at your workplace, so that it's easy and convenient and you have that reminder. The second thing is don't touch your face. As I said earlier, you can pick up the virus from any surface. And interestingly, we had a forum a couple weeks ago where we were talking about pets. And if someone has COVID-19 in your home and they're interacting with the pet, you could pick it up from their fur. So be careful about that. So any surface potentially, if someone who had COVID-19 was coughing, sneezing, etc., then those surfaces can be really problematic. So wash your hands when you touch surfaces, doorknobs, any surface that you touch, and remember not to touch your face. And then keep yourself distant. So lots of discussions about social distancing and how hard it is because we're human beings and we're social, and we have kind of a dedicated amount of space that we have between each other, right? You tend to move in or out to maintain that space. That space really needs to be farther. So a good judge of that is if you can stretch out your arm and the person next to you can stretch out their arm, and you touch each other, you're too close. So if you can touch me, you're too close to me. And then the last thing I would say is just considering being isolated. So there's lots of conversations about states having isolate in place orders. But what we really want people to do is, if you don't need to go to a public space, don't. So try to only go to the grocery store when you absolutely need to. Try to go in, get what you need. Don't do a lot of looking and considering things. Go get what you need and then come out. So that isolation is really important, and probably is really most important for the elderly. So I've heard a lot of people say to me that, I'm just resigned to getting it. I'm just going to get it. It's just a matter of when. Those sorts of statements I really think are false. I think that no one can make themselves risk-free, but I think we can do things that decrease our risk of getting this virus. And it's really about those things we just talked about.
Great. Thank you for touching on that, because I think there is some confusion about that with the general public, that it seems so scary that it's easy, I think, to have that mindset of, well, it's so contagious, I'm just going to get it. But you're right. We can all do our part to reduce the risk of anybody getting it and from spreading it. So if you're just, oh, I'm sorry. Go ahead, Dr. Brennan.
Maybe I could touch on the mask question, because I think that's probably really important. The CDC now, over a week ago, recommended that all of us wear a mask when we're in a public space. You might notice that Elizabeth and I are not wearing any sort of protective equipment. And that's because we are in a private space and we're not with people. So I'm in my office and she's working from home, right? And there aren't people around us. And so when you're in that situation, it's okay to not be wearing a mask or a shield. But when you're going out into a public space, you should have some sort of protection. Here at the university, we actually chose to go with face shields as opposed to face masks. For a couple of reasons. The first reason is that they're reusable. So they're hard plastic. I actually have one here I can show you. It's highly attractive. And it just goes on your head like this and covers your face, covers down to your chin here.
Yeah, some of our
prevents the-
pediatric patients think we all look like Darth Vader when we're wearing them.
It's true. And when you breathe, you kind of feel like Darth Vader, actually, because your breathing is coming right back at you. But that's the beauty of it, right? So it contains where you're breathing. It goes around your face. It prevents you from touching your face. You actually have to try to touch your face when you have these shields on. And so it helps with those droplets. It helps with not touching your face. And it's reusable. We can wipe them down with an antiseptic wipe, and they can be used day after day. The CDC recommends for people to use a mask. And if you don't have access to a medical mask, which most people don't because they're in short supply, then you should wear a cloth mask. And there's lots of patterns out there. I've been asked, what's the best pattern? I don't think we know. I think we've said that so many times with respect to this virus that, we're learning so much. But the recommendation from the CDC is to use, when you're making these masks, to use cotton, a high thread count, more than 165, I think, and to have it be expandable. So that it will go over from the top of your nose down under your chin. It can either have straps on it or it can have straps that go around your ears. Either one is fine. The best masks would have some sort of a filter in it that would filter out those viruses and things that could be coming in. And most people don't have access to those filters. So I've seen on some websites that people are using pieces of a vacuum cleaner bag because they have a filter in it. They filter the dust and dirt that you put into the vacuum so it doesn't go all out into the house. So that's something that you could put in between those two layers. But those things potentially help us. And the way they help us is what we call source control. So if someone who is sick or who is about to be sick, asymptomatic, but maybe coming down with this, wears a mask, that prevents their droplets from then going into the air. So if we're all wearing masks, then if any one of us is about to come down with this virus or has some symptoms of the virus that we don't recognize as being COVID-19, then it decreases the risk of transmission.
Yeah, so it seems like an easy way we can all do that, playing our part.
Exactly.
So if I wear a face mask, like I wore one to the grocery store the other day, I put hand sanitizer on. I grabbed one of my clean reusable masks that I had laundered, put it on. When I got out of the store, I did hand sanitizer and took it off and put it into the laundry. Is that what you recommend to be safe while using those cloth masks?
Absolutely.
Okay.
Yeah, you did a good job. Very good. So most importantly is just to remember that the reason you have the mask on is to filter anything that's coming towards your face. Mm-hmm. And so the outside of the mask you should consider to be contaminated or dirty. Okay. So you don't want to touch it when you're taking your mask off. And always you should use hand sanitizer or wash your hands after you take them off. Now, some people might say, well, what do I do in the car, right? Because I'm not going, I'm not home yet and I want to wear it in the car. You can get a paper bag. You should use paper because you want if there's any virus on it, you want it to dry. You don't want it to maintain moisture. And so a paper bag, so you could just keep that in the car, throw it in the paper bag, and then dump the paper bag into the laundry when you get home.
Right, great. Thank you for that information on cloth mask. I think that's been a thing since the CDC made that announcement. A lot of people have been wondering, well, what do I do? So this is great information. If you're just joining us, we're here with Dr. Teresa Brennan, Chief Medical Officer here at UI Hospitals and Clinics, talking about COVID-19 and what we know now. Please comment with your questions below and we'll answer as many as we can throughout this stream. So there are some articles floating around the internet that downplay the importance of social distancing, encouraging people to actually get together more so people can develop what people call herd immunity to COVID-19. We're still recommending people social distance. So do you mind talking about this and maybe helping us set the record straight a little bit?
Absolutely. So let me just talk about what herd immunity means. Herd immunity means that people around you have the potential to not get the infection, and then because of that, then you don't get the infection because the people around you aren't at risk. And that can happen a couple of ways. It can happen because we vaccinate. So we talk about herd immunity when we talk about the influenza vaccine. If I, for some reason, can't get the vaccine because I've had a reaction to it, but everyone I'm around has gotten the vaccine and the vaccine's effective, which it's not always effective for influenza, then I have some immunity just innately because of the people around me being protected. Herd immunity can also happen because you're exposed to people that have an infection and then you develop antibodies to it. So because you're in that herd or in that group, you develop those antibodies. And herd immunity, we talk about as a good thing when we talk about influenza vaccination or other vaccinations. I know when I was growing up and after, that people used to have chicken pox parties. You remember that? Where somebody in the neighborhood would get chicken pox and people would take their kids over there so they got chicken pox because we thought chicken pox was really benign and it really didn't harm people. We now know that you can get more serious infections with that, and also you can get something called zoster, which comes later. So maybe getting chickenpox isn't a good thing, but that would have been something that that might have been done in the past. Distancing helps for people not to get this virus because you limit the potential exposure of someone who might have the virus or be carrying the virus. If this virus was harmless and didn't cause people to die, we would say it's okay to do that, right? That if people get it, they're just going to be a little sick and they're going to feel better later and not going to have any bad things happen to them. Then we might say, you don't need to distance. We actually may think of the common cold that way, right? Most people don't have serious side effects. Most people, some people do, when they get the common cold. And so when someone gets the common cold, we don't really try to get far away from them. We don't wear masks around them because it's not a virus that causes terrible outcomes. This virus causes terrible outcomes. I mean, you hear every day in the state of Iowa, Johnson County, in the nation, that potentially people are dying of this virus. And so because of that, it's really not a good idea to just allow everybody to get it. Even if it's young people who tend to have a lesser course, because those young people may interact with an elderly person and then pass it to that elderly person who then could have a bad outcome. Social distancing is the right thing to do, and we should all continue it as long as we can.
Thanks for tackling that topic for us, Dr. Brennan.
I thought I lost you there.
Nope, I'm still here. You can't lose me today. I want to loop back to face masks for a moment. How are we protecting our staff members who are working to provide care for our existing patients and our patients who have COVID-19?
So I'm really proud to say that our hospital epidemiologists are probably some of the best in the nation. Hospital epidemiologists are a type of doctor that there's not a lot of them, and we have many here, and they're people that are highly connected to the CDC, are internationally known, and so we're very fortunate to have these people who do this every day to look to say how should we be dealing with this infection? How should we be protecting our people? Because that is really important that we protect, for sure, our patients. Of course, we always do that, but protect our staff and also protect the visitors that come. So from the beginning, we've had conversations about what is the best protective equipment. Unfortunately, during this outbreak of COVID-19, that personal protective equipment is in short supply, and it's in short supply because the virus has spread everywhere, and those supplies are being used up faster than they can be made. And so when one's faced with those situations, you have to make good recommendations, recognizing that potential risk could be higher in the future and you may need that PPE. And so with all of those things in mind, our recommendation presently is when any of our employees are in the hospital and they're not in their own private space, their own private office where there's no one else with them, they should have a shield on, always. They don't have to take it home with them at night, but they may if they want to. If they ride the bus and they want to take it with them, that's perfectly fine. So they should put it on as soon as they get here in the morning, and they should take it off right before they leave at night. And those times should be car or bus to office, office to bus or car. They shouldn't be stopping and greeting people, going to the gift shop, etc. Most recently, the CDC has recommended masks for everyone, and we're now presently in conversation about whether everyone should be wearing a mask. And that might be something that does happen over the next several days. When we have patients taking, and when we have employees taking care of patients, they need a little bit extra, particularly if it's a patient we suspect is COVID positive, meaning they have symptoms that we're worried about, but they haven't had a test yet, or if they've tested positive. Those people would always wear a face shield, a medical mask, a gown, and gloves. And they would take those off when they're not in with those patients. Sometimes, I talked a little bit earlier about these aerosol generating procedures. Sometimes we need even better masks. And so we use what's called an N95 mask. That just means that mask has been tested that 95% of a certain very, very, very small particle is filtered out when it goes through the mask. Those masks have to be fitted so that they fit tight to your face. And for patients that are having those procedures, the people in those rooms would substitute out that N95 for that medical mask. Things have changed a lot since we started, but I'm really, I feel like we have done a good job in trying to keep our people safe by getting everyone a face shield. And for those of you that are not familiar with the University of Iowa hospitals and clinics, we're talking about 15,000 face shields. We now are accepting cloth masks. So if anybody out there is making cloth masks and they want to donate them, we would be very grateful for that.
Awesome. Thanks for the update. So if we're going to kind of pivot a little bit and we're going to talk about the patient experience with COVID-19 at our hospital. So if someone tests positive for COVID-19 but doesn't require hospitalization, how do we continue to provide care for them at home?
Yeah, I think, the routine for that, whenever someone has an infection and they can be at home, is to say, you should watch for these things, and if they happen, call us. What we were finding is that patients were, our first patient who came in was sicker than we thought they should have been maintaining themselves at home. That patient came in and went actually directly to the ICU. And so what we felt like we could do a little bit better job than that. So presently here, when a patient has a positive test, we call them and tell them the test is positive. We then courier a kit to them that includes a blood pressure cuff, a pulse oximeter, which measures the amount of oxygen in your blood and also measures your heart rate, and a list of things that they need to watch for and what they should do if they have those things. A nurse then gives them a call and talks them through all of those things, asks how they're doing, and then lets some of those patients know that we will be calling them on a daily basis. So particularly those that are over 60 because of their increased risk. Any patient who's been with us in the hospital and has been discharged, we consider them to be a little higher risk. And then pregnant patients who have COVID-19 and anyone else that a doctor says, I'm worried about this patient, they'll get a call every day from one of our physicians, and they go through what their vital signs are, like what their blood pressure was today and what their heart rate was and what their oxygen was and how their symptoms are. And what we found in this is that course that I just told you about is pretty reproducible, that 80% or more of patients can stay home. And those first 5 to 7 days are pretty predictable, and people feel bad, but some people recover during that time, and then that people then go on to have worse outcomes. Some people. So what we found is that you've heard in the news perhaps that when this virus attacks people, it actually affects their sense of smell, and it can cause them to have a very bad taste in their mouth. And our patients have described that as like they're eating or drinking dirt or even metal.
Ooh.
And it's very unpleasant. And so even when we've had physicians who have had COVID-19 and they know they have to, or nurses who know they have to continue to hydrate, they've not been able to do it because of these symptoms. And so those docs act as coaches and make sure that, how much did you drink yesterday? They ask them what the color of their urine is, because if you're not drinking enough, the color of your urine will become more yellow rather than lighter yellow. And so by interacting with them daily, we've really been able to keep people out of the hospital. So I've said many times that 80% of people can stay out of the hospital. That means 20% of people get admitted. And I can just tell you from the last, this was data from a couple days ago, so it's not most up to date, but pretty close. We had 200 patients go through this program. 115 of them have recovered and been discharged from the program. So we use the word discharge because we think of this like a home hospital, like a virtual hospital at home. 50 patients are actively being followed by our docs, and the other 35 were being followed by our nurses, or nurses would intermittently call them. To date, of the 200, 9 people had been hospitalized. So if you think about 20% of that, right, 20% would be about 40 people, right? And we've hospitalized 9. So it may be that the population's a little different, but we've had a number of elderly in that population as well. And we're really excited to be able to keep people out of the hospital. And it's really about making sure if you get the virus that you continue to eat and drink, but most importantly, to drink. Because you're losing fluids with your fever. Some people have diarrhea. And so that getting fluids back in your body is really important. And I'm pleased to say that we haven't had any patients that we've lost in that group. So that's really, really wonderful.
Yeah, it's very promising. And at least for me, I know that gives me kind of a sense of calm to hear how we're responding to this and how we're keeping our patients safe. So our next question is, if someone does test positive, doesn't need to be hospitalized, can stay at home. We're providing that virtual hospital, but what do they need to be doing? How long do they need to isolate themselves from their family members? And how long should they be staying at home?
So the isolation we would recommend that they have their own bedroom and preferably their own bathroom, and that they remain in those 2 rooms and not go into common space. That someone deliver them, drinks so they can drink, food if they can eat, and just make sure that they really are isolated from the rest of the house. That's the best way to protect everyone else in the house. The rest of the people in the house should be wiping down counters and doorknobs, hand hygiene gel. If you have a mask, that would be optimal, particularly for the person that has COVID-19, because remember that source control is so important. And that should occur for at least 7 days from the start of the symptoms, and at least 3 days from the time the fever went away with no medications to lower fever, like no Tylenol or ibuprofen, and the symptoms are improving. So what that means, it's the longer of the 2. So if someone does really well and on day 4 their symptoms are gone or better and their fever is gone, then they might be able to come out of quarantine at 7 days. That would be very fast, but it would be at least 7 days, and then it has to be 3 days after fever's gone and symptoms are better.
Thank you for that. So we've got time for, I think, 2 quick questions, and then we'll let you get on with your busy day. Do we know of any promising treatments out there for COVID-19?
Sure. There is no FDA-approved treatment right now for this virus. It's all what we call supportive care, meaning we give oxygen, we give fluids, we give nutrition, etc. There is a medication called remdesivir, which is an antiviral, so it affects the virus itself. And with it affecting the virus, then it helps to slow the progression of the disease. We have that available in investigational use. The trial has been around for a few weeks and it's filling up rapidly. So I'm not sure how long there'll still be openings, but certainly we have delivered that to several patients here. The second is something called convalescent plasma. When someone is fighting an infection, they develop antibodies. And when that person has recovered, they no longer have the virus in their system, but they have the antibodies. We can collect the plasma, which is just the watery part of blood, with those proteins, those antibodies in them, and use that to give to a patient who's struggling with the virus presently. So we use that as a treatment. It's called convalescent plasma. And we have an investigational use for that now. So we are delivering that to some of our patients. And, it's Iowa, and we have had really great involvement of patients who have had the virus who really want to get back and donate their plasma. So it's been really wonderful. The last thing that's probably the most exciting is if you don't get the virus, it's probably best, right? So coming up with a vaccine. There's a lot of people working on it, and I'm really pleased to say that a lot of people here at the University of Iowa working on it as well. Some of the labs that have worked on the MERS virus, because it's kind of a sister to this virus, they're both coronaviruses, there's really promising results. So we hope that that vaccine comes very soon.
Yeah. So the last question is, I just wanted to give you a chance, Dr. Brennan, to let our audience know anything else you think is valuable for them, including maybe touching on the fact that we're still here for more than just COVID-19. We're still here to change medicine and change lives for Iowans.
Yeah, I mean, whether you get your care here or Facebook, you could be watching from very far away. If you have chronic medical problems, or if you have an acute medical need for medical attention, we talk about coronavirus every single day, and I really worry that the patients that have medical need for medical care kind of get lost if they don't have coronavirus. And we certainly know that people need to continue to have their doctor's appointments. They might continue to need to come to the emergency room for an emergency event. And I'm particularly sensitive to this because my patients need to be followed, and they can't just take 3 or 4 months away and ignore their symptoms, because that could result in some really bad outcomes. So we are open, as are many hospitals. We are trying to not have people on site to really allow for that distancing. So people that don't need to be here, including visitors, we've actually gone to a no visitor policy with some exceptions, which was really hard because, visitors are important, family members are important for healing. We want to decrease that, but we do want patients to come if they need to come. And so what we're doing here is our providers and our nurses are calling the patients, finding out how they're doing. If they need to come on site, we have them come on site, and we do everything we can to protect them. I really believe that because of all the things we've done, that this hospital is no different than going to Hy-Vee for your risk of catching the virus. And so if you have to come, you should. I really worry about people avoiding going to the doctor because of fear of the virus, when what they should be going to the doctor may be actually much worse for them.
Great. Thank you so much for sharing your expertise with us today, Dr. Brennan.
You bet.
And thank you for everyone who tuned in. If you tuned in later during this broadcast, make sure to go back and watch from the beginning so you can hear all of the great information Dr. Brennan provided us today. And stay tuned to the UI Healthcare social media accounts on our website, uihc.org, for more information about COVID-19 as we have it. And remember, please wash your hands often and continue to practice safe social distancing. Thanks for watching.
Yeah, stay healthy and stay safe.